What is enteric fever? Typhoid. It is a bacterial infection caused by Salmonella Typhi. This fever is called enteric fever because it primarily affects the intestines. The term enteric is derived from the Greek word enteron, meaning intestine. Symptoms vary from mild to severe and usually begin 6 to 30 days after exposure. Why is it named typhoid fever? Typhoid fever is named for its similarity to typhus, another illness with overlapping symptoms, particularly the high fever and mental confusion. The name for typhoid comes from the Greek word typhus, which means smoky or clouded, reflecting the mental state of patients with the illness, who often experience stupor or delirium. While both diseases were initially confused, it was later recognized that typhoid fever was distinct and primarily affected the intestines, while typhus was a separate illness, caused by different bacteria and transmitted by lice or fleas. What is the cause of typhoid fever? Typhoid fever is caused by the bacterium, Salmonella Typhi. Salmonella Typhi lives only in humans. Persons with typhoid fever carry the bacteria in their bloodstream and intestinal tract. The Salmonella Typhi bacteria will be in the stools of an infected person after they have been to the toilet. If they don't wash their hands properly afterwards, they can contaminate any food they touch. Anyone else who eats this food may also become infected. What are the signs and symptoms of typhoid fever? Typhoid fever, caused by Salmonella Typhi, presents with a range of symptoms that typically develop 1 to 2 weeks after infection. Common symptoms include prolonged, high fever, fatigue, headache, and abdominal pain. A characteristic rash of flat, rose-colored spots may also appear. Other symptoms can include loss of appetite, nausea, constipation or diarrhea, and in severe cases, delirium or hallucinations. How to prevent typhoid fever? To prevent typhoid fever, focus on vaccination, safe food and water practices, and good hygiene. Vaccination is recommended for those traveling to high-risk areas. Additionally, ensure food is cooked thoroughly, and avoid consuming food or drinks from unreliable sources, especially in areas with poor sanitation. Frequent hand washing, especially before meals and after using the restroom, is crucial.